On this first full day of fall, it's the perfect time for fall prevention. Not the season, we're talking about the stumbling. Bobby Hammond is owner and president of Atlantic Physical Therapy and joins us this afternoon. How you doing, Bobby?
Hello, how are you?
Doing great. Now, studies show falls are the leading cause of injury among those who are older, and you probably see it all the time, don't you?
We do see a lot of it. And it's a shame because these are supposed to be some of the best years of people's lives, and falls can hinder a lot of that.
Sure, because it's not just bumps and bruises people are getting. They can get seriously injured.
Yeah, and that's a good point. You know, everyone thinks of when they hear traumatic brain injuries, we always think of the NFL and concussions and boxing. But one of the lead causes of traumatic brain injuries are falls in the elderly. So you're exactly right.
Yeah. So let's talk about how these falls happen. I know a lot of time there are hazards inside the home. Can you tell us about where they are and what they might be?
Yeah, a great first step everyone can take is get rid of your throw rugs. First and foremost, it's one of the lead causes of trips and falls in the home. You know, you might not think of it, and if you don't want to get rid of your throw rugs, then put one of the surfaces underneath so it doesn't come up and your foot doesn't trip over it. Another thing is dim lighting. You can go out and get night lights, or make sure the area is well lit so that if you get up in the middle of the night, it's well lit and you can see where you need to step, if there's any obstacles in the way, any pets, etc. Another thing that we can all do is extension cords, or if there's lamps, just make sure they're not running across the walkway, because that's another tripping hazard. You'd be surprised, little things like those, especially in stairways and doorways where it's dark, they're big causes of falls that we face.
Let's talk about other ways we can prevent the falls, things that we can install in our house as we get older.
Yeah, so little railings that you can hold on to, especially in the shower. As you figure, as we start to age, sometimes our vestibular system starts to, not respond like it used to. So we close our eyes and we're washing our hair, we tend to feel unsteady, or if the shower's slippery, little things that we can hold on to, especially getting up from a toilet, that definitely helps. Railings going into a home, sometimes people don't have railings to, even with just a few steps getting in and out, a railing makes a lot of difference.
You know, sometimes you fall and you think you're okay, but can things happen later on that maybe you should have had checked out after the fall?
You know, as we get older, we tend to have things like osteoporosis, or if there's arthritis in there, but especially osteoporosis. And if we fall, sometimes the hip is at risk of being broken, fractured, etc. So after you fall, if there's any sort of pain, it doesn't ever hurt to go and get checked to make sure that you didn't fracture or break your hip, because that's something that you want to deal with right away. So it's always better to be safe than sorry.
Absolutely. And you know, we're talking to people who are older, but I think we should mention that we need to look out for these things in our parents' homes and our elderly neighbors' homes, these things that can cause falls.
Listen, absolutely. If you go into we are a brother's keeper. And if you go into someone's home and you're watching this and you see throw rugs, help use these tips that you guys are watching today and implement them in people that you interact with on a daily basis, especially your neighbors. Get rid of the throw rugs. Look for good lighting in the homes. Get rid of wires or tripping hazards, anything like that, because one fall can change someone's life.
That's right. Good advice. Bobby Hammond with Atlantic Physical Therapy. Thank you so much, and enjoy the rest of your day.
No problem. I just want to say one more thing. Fall prevention, if you look at the research, is one of the best things that you can do. And in physical therapy, that's a big thing that we do, is assessing someone's fall risk, implementing a home exercise program. So that if you think you're on the cusp or you're worried about having falls, come see us at Atlantic. We have a great program. We're the best on the shore. And I wish everyone a happy fall.
Thank you. A happy fall season.
Yes.
All right. Thank you so much. Good advice right there.